And good evening, ladies and gentlemen, and welcome to the Your Health is Important Facebook Live broadcast. I am Dr. MJ Carr, your host, producer, on-air personality, and I'm here to answer your healthcare questions. You can tune in now, ask your questions, and we're going to go live on Facebook. You know how it works. It's your show. I'm going to introduce a topic, but after that, you can ask any question about any medical topic that you like. It's such a pleasure to be here with you this evening. We greatly appreciate you being here. Thank you so much. And we appreciate all of you that are out there because we know you have choices. It is Wednesday night, August 25th. We're starting right on time at 6:30. We're going to stay here for as long as you have questions. So thank you so very much. Of course, the hot topic. And thank you so much, Sharon. We appreciate you from Chicago. You know, we want to know where you're calling from and everything. So thank you so much for tuning in and get your questions in right now. The hot topic, of course, the Pfizer vaccine received full approval from the Food and Drug Administration. KK Alexander, thank you so much from Miami, Florida. We are north, south, east, and west. Already Chicago and Florida, Miami, south as you can get. Hope the weather's better down there now. And Melissa Sullivan Alley from Virginia. Thank you so much, Melissa. We appreciate you. So Pfizer received full FDA approval on Monday for their vaccine. Does this make a difference in reference to you taking it versus when it was under emergency use authorization? The EUA was given after the vaccine had proved itself for 3 months. So that is basically the bottom line. The real difference between an emergency use authorization and full FDA approval is the amount of time that the vaccine has been made available. So they had 3 months, in addition to the time it was in its study, they had 3 months to utilize it, make sure it was not creating any problems and that people were taking it without any substantive side effects. And then after 3 months, you start to mark time, you count time. Originally, when the vaccine was presented, they said that it had an efficacy that would last you up to 3 months. They said that because they only had 3 months of data. There were other studies from around the country and around the world that were showing efficacy up to 36 months. So we are now in real time timing how long this vaccine will provide you with protection. One of the problems that has been noted is that as of this time, the efficacy of the Pfizer vaccine is decreasing. It's also decreasing with the Moderna, but not decreasing as much. The numbers that we are looking at and that have been quoted is that both of them were roughly 85 to 95% effective upon initiation. The Pfizer is now down to 45% efficacy, and the Moderna is at 85% efficacy. So that basically gives you your choice of vaccines to take. And the data is not available for the Johnson & Johnson because it has not been on the market long enough. So we fully expect the Moderna to have full FDA approval within the next month. That's approximately the same timeline that it was released after the Pfizer. And we're not sure. Johnson & Johnson has not applied for full FDA approval. So we're not sure whether that's coming, pending, etc. Now, with full approval of the Pfizer vaccine, what we have now are the vaccine is approved for down to age 15. Okay, so between the ages of 12 to 15, you're going to have still operating under the emergency use authorization, the EUA, but down to 16 and above, the Pfizer is clear. Now, because it's now still under emergency use authorization down to age 12, people that have children younger than 12 are concerned. How quickly will it be out? Dr. Fauci, Anthony Fauci, the nation's infectious disease expert and head of the coronavirus task force, was quoted as saying that he expects it to be out maybe around Christmas time, possibly as early as November. Everybody's saying that's a little late. We're going to be in the middle of the winter, and this pandemic will be totally and completely out of control. We do not want children out of school. So right now, the only viable therapies that we have are mask wearing and social distancing. So wear your mask, wear your mask. The masks have been proven to be effective in decreasing and preventing transmission of this highly virulent Delta variant. The Delta variant varies from the Alpha variant of the original coronavirus vaccine. It has 4 different mutations that have allowed it to be more virulent. It's more potent. It's spread more easily. But there's one in the background, the Lambda. It has 7 different mutations, and we're not sure what's going to happen when it rears its ugly head. Right now, over 90% of infections are Delta. And so the lambda is there, but two things cannot occupy the space at the same time. So we're not getting a lot of push on the lambda as of yet. But look for it within the next 2 to 4 weeks. You're going to start hearing more and more about the lambda variant. And the question is, will it be even more virulent, more potent, more easy to spread, or even it could also possibly be less virulent, less potent, less easy to spread? But right now, we have to worry about this Delta variant. This Delta variant is just showing out. It is really, really going fast. We now are having a record numbers of admissions from young people, particularly in the pediatric age group. Every pediatric hospital system in the United States of America is overwhelmed right now with admissions, because normally children aren't admitted to the hospital. They're treated, they go home, their parents take care of them. It's highly unusual for a child to need to be hospitalized unless they have like a bad car accident or some other type of disease state that they're born with. But under normal circumstances, most children, even if they get sick, they usually rarely require hospitalization. So now we're in a position of seeing not enough beds, and they're having to convert other units to take care of children. Other hospitals that usually traditionally take care of adults are now having to deal with children, and it's not a simple thing. Children aren't just little people. Oftentimes they require a whole different set of circumstances. People who are trained in pediatrics, smaller needles to take their blood, smaller IVs to start their fluids, etc. You just have to know how to deal with children. It is a true specialty, and we are at a deficit right now of people that can do that. Physicians, pediatricians, nurses that know how to take care of children, pediatric specialty nurses, we are in short supply of. So right now, the military is sending support groups. FEMA and the National Guard are trying to go to hospitals and help support where there are not appropriate staffing levels. So that's where we are with that. The Pfizer is fully available now. You can get it. Go and get it. If you have a choice of vaccines, my pecking order and what I recommend first, and this is Dr. Collier's medical opinion, is the Moderna vaccine first, then the Pfizer, and then Johnson & Johnson. If you just have to have one shot, if it's difficult for you to get back for your second shot or any of those problems that you're going to have, that's where we want to be. So let's talk about some of the other issues that we have. One, we are still worried about boosting our immune system, because the only viable treatments that we have now are infusions of antibody cocktails. There are 3 different products that are available. One has one has 2, and I think one has 3 antibodies that you can have infused. That is instant therapy that gives you the same benefit as if you were vaccinated. The thing about getting the vaccine is this: you get vaccinated today, it's going to take your body 2 to 4 weeks to build up antibodies, so you still won't have protection at that time. So if you are sick, if you're diagnosed acutely with the coronavirus, and it appears that you have a more moderate or severe disease state, that's one of the therapies that you should be offered. If you aren't offered it, you ask for it. Tell them you want antibody therapies. It is available, but oftentimes the primary therapy has been to do as much nothing as possible. Watch people, wait until they deteriorate, then put them on a ventilator. This is not the way medicine is traditionally practiced. Normally we are aggressive and go right in and challenge things. So it's very important that you protect yourself by boosting your immune system, taking some products that can help you. The number one most recommended product, of course, is vitamin D. Vitamin D comes in 2 versions: vitamin D2, which is inactive vitamin D that your body has to convert to vitamin D3, which is the active vitamin. Now, some people convert D2 to D3 very efficiently, and this is not a problem. Other people do not do that, and so they can take high doses of D2 and never get decent levels of D3 because their body does not convert it in an appropriate manner. So cut out the middleman, go straight to vitamin D3 and get a D3 product that is at least 5,000 international units per day. Traditionally, people would take 1,000 or 2,000. That is not a high enough dose to completely boost your immune system. The normal range on vitamin D therapy is 30 to 90. You want your vitamin D level to be at least 40. That's when you get immune system boosting, and of course higher levels than that give you greater immune system boosting and have been associated with decreasing and preventing cancers such as prostate cancer in men, breast cancer in women, colon cancer in men and women, and probably all other cancers. Most people, as soon as they're diagnosed with a cancer, they're started on vitamin D by their provider because it's just one of the most effective and elegant things that you can do. It has no downside. It does no damage to any of your tissues. It just allows your own immune system to be a better army to fight that invader that's trying to take over your body. So vitamin D3, our product, Doctor's D, has 5,000 international units. You can take it daily. It's a small caplet. It's easy to swallow. It is very, very good. Dr. Collier takes this every day to boost his immune system and to improve my vitamin D levels. So I think the last time I checked my vitamin D level, it was 86. And so that's ideal because, again, the normal range 30 to 90. And I think that is because, again, we are taking the 5,000 international units daily. You can take this with food or without food. It is better absorbed with food, but without food, it's still perfectly okay. It just depends on whether you have food available. Just make sure you drink enough water with this or any other product that you ingest, including vitamins, aspirin, etc., so that you can dissolve the tablet. It goes into solution. It gets out of your stomach and into your system. The biggest problem that we have when we're taking medications, supplements, or anything else is that we don't drink enough water when we take it. This is the scenario. You get a glass of water, you fill the glass up. You take a sip. You take the pill. You take a sip. You possibly take another sip. Make sure it's going down. Then you throw the rest of the water in the sink. So that is not what you need to do. You need to complete the full glass of water. That's going to literally melt the tablet. Do a small experiment. Take any type of pill that you have, but something that's inexpensive so you won't waste medicine. An aspirin. Get you a clear glass. You fill one glass about an inch of water and put one aspirin in that. You fill the other glass to the top and put one aspirin in that. Don't shake it, agitate it, stir it, or anything, and just watch what happens. Basic physics. When you have a larger fluid base, the tablet is going to dissolve. It will be gone in 2 minutes or less. And that's exactly what happens in your stomach. It's absorbed. You don't feel it. You don't taste it. You don't burp it. You don't have any kind of bad feeling about it. It doesn't give you a tummy ache. It doesn't give you nausea because it's out of your stomach and it's into your system. It's only when you wet a tablet, the tablet sits on the lining of your stomach. It can become very irritating, but it also is very concentrated. So you're feeling it, possibly burping it. It doesn't taste well at all, which causes nausea. And so now you're reluctant to take the next dose of that medication, whatever it is. And it's not that you're allergic to it. It's not that it causes any of those problems. It's that you're not using an appropriate technique to take the medication. So Dr. Collier's pearl for the day is when you take any medication, from aspirin to vitamins to your prescription drugs, always make sure that you're drinking enough water so that you don't have that problem. So vitamin D, again, 5,000 international units a day. But there are other supplements that have been recommended as well for patients that are trying to boost their immune system. One of the most common things is zinc. Then there's elderberry, black elderberry extract, liposomal vitamin C. And I say liposomal because that means it's fat-based and it's easier to absorb than traditional vitamin C is. So the dose that you want to take is 1,000 milligrams of vitamin C per day. Elderberry, 500 to 1,000 milligrams. Zinc, you really want to get between 30 and 50 units in a day. So we have a product, Lipoimmune, because that's a difficult pill burden. But Dr. Collier is taking all of his supplements. I take my probiotic, I take my omega-3 fish oil, I take my vitamin D every day. Then if I also have to take zinc, if I also have to take elderberry extract, if I also have to take vitamin C, now that's 6 or 7 pills that you're taking in, and it's just difficult to do that. You could literally take all of them at one time, but I don't do that. What I do, I have a regimen in the morning. It starts as soon as I wake up. Upon awakening, I'll take 1 pill. Then I go to the restroom, wash my mouth out, I brush my teeth, take another pill. Then I gargle, then I take another pill. Then I have to shave. I'll shave, take another pill. And so as I progress through my morning ritual, I'm taking pills and giving some time between each one so that it has time to dissolve, get out of my stomach and into my system. And I drink plenty. That allows me to get started on at least 3 to 4 glasses of water in the morning before I've hit my stride. And it's recommended, of course, that you drink 8 to 10 glasses of water per day. And nobody does that. And you need to do that. Everybody who wants to lose weight, they say, what can I do? The first thing I suggest to them is that they need to drink more water, because just drinking extra water, it will diurese you, it will help metabolize things, it will help move your metabolism and help you lose weight. So again, secret, doesn't cost you anything if it's tap water, but it doesn't have to be any glorified type of this water with extra things added to it or not. Just regular water. If you want to drink bottled water, that's fine. But remember, tap water, particularly in the United States, is fortified with fluoride so that it helps your dental health. One of the things that we have observed as healthcare providers, particularly my dentist friends, is that people are spending their entire life drinking bottled water, starting from childhood and even as babies. They never get the fluoride that's in the tap water, so they start to have dental problems very early. And so, and oftentimes will have, by the time they're adults, really bad dental caries, they're losing teeth, and then they have to get dental implants or dentures. So a simple and elegant solution, and that's what we talk about all the time, is making sure that you get fluoride from your normal daily habits. And you can get that in tap water throughout the United States. So people that have been, on lockdown, we Netflixed and chilled for over a year during the first part of the pandemic before we opened up, and now we're getting out and about. People have learned and realized they're now able to put back on clothes that they weren't wearing before, and those clothes aren't fitting. So they say, oh my goodness, I put on 10, 15, 20 pounds. The average weight gain during the coronavirus period for the average adult was about 15 pounds. I've had people that have gained more than that, but, and some people that have gained less, but the vast majority, the average weight gain was approximately 15 pounds. So that is 3 belt sizes and 2 dress sizes. So it's very important that now we get that weight off. Now we're more active, we're out. And what are some of the things we can do to do that? As adults, as we age, our body loses the ability, or our ability is decreased to metabolize fat. I think we all remember when we were adolescents and we had something we were looking forward to that weekend, or a party or a wedding or something like that. We could just almost decide we wanted to lose weight on Monday, and by Friday we would have lost 5 pounds easily, just basically by desiring to do so, because our body could metabolize fat very efficiently. And if we limited what we were taking in, did any type of aerobic exercise, you could lose that weight very quickly. As we age, we lose the ability to do that. The essential amino acids that are necessary for the appropriate metabolism of fat, the levels start to decrease in our body. So it's very important that we replace those things. That is how we came up with the Lipodrops formulation. The original formulation was an injectable called Lipovite. This is utilized in weight loss facilities around the country. So when you see medical weight loss, that is one of the things that's being utilized in there, the Lipovite, which gives you B12 and several groups of amino acids that help you metabolize fat. Well, that's very effective. The thing is that people would come to the weight loss facility, get the injections, and lose weight, but then life intervenes. It becomes difficult to come to the weight loss facility and get the shots. So people would say, can you give me the shots and let me take them home? And there are facilities that would do that, but some people are shy about giving themselves a shot. I know that I couldn't give myself an injection. It would be very difficult to do so. It's just a large ick factor in doing that. So I didn't recommend it, and I don't do it, and I don't allow my patients to do it. I don't send them home with injectables. But we realized that you could take those products, make them into a sublingual formulation. That means is you take it and you give it to yourself under your tongue. When you do that, it's absorbed as effectively as if you received an injection. So that is how the Lipodrops formulation was developed. Lipodrops contains 2 key amino acids for optimal fat metabolism, L-carnitine and choline. About 20 years ago, choline was recognized as a very, very effective supplement for weight loss, and there were a lot of products put on the market that contained choline. But what we found out was L-carnitine was absolutely a great partner for the choline. And then, of course, everybody knows when you get vitamin B12, it gives you energy. That's the question. I ask people, what does vitamin B12 do for you? Or they come in and say, Dr. Kari, I'm just feeling tired. I got a lot of work I need to do. I need a B12 shot so I can perk up. And so that's one of the things that you can take. Everybody knows that B12 gives you energy. What you may not be aware of is that B12 gives your body permission to lose weight. It does not cause you to lose 1 pound. Okay, but what it does do is turn on the mechanism that your body needs to utilize to make yourself lose weight. So when that happens, it tells your body, you take B12, and it tells your body, okay, we want to lose weight, let's do it. Because weight loss is an abnormal condition. Your body does not like to lose weight. Your body does not want to lose weight. and it fights you the entire time. And that is why over time, when you're dieting, the longer you diet and the more successful your weight loss is, the more challenging it becomes because your body starts to fight you in increasingly higher effort. And so there's a hormone called ghrelin. I call it ghrelin the gremlin. And as you lose weight, the levels of that hormone get higher and higher. And what the ghrelin hormone is doing is telling you to eat so that you will return back to your preset set point of whatever your body weight was when you started to lose weight. And that's why people will oftentimes join a weight loss program. They will lose 20 to 30 pounds. They stop doing what was in the weight loss program and they gain that weight back, oftentimes exceeding it. So they lose 20, gain back 30, lose 30, gain back 40. And the problem with that is that when you lose weight in about a 2-to-1 ratio. So for every 15 pounds you lose about 10 pounds of fat and 5 pounds of muscle. So when that happens, you start to lose your muscle mass. But if you stop dieting, usually a calorie restricted model, and you gain the weight back, the weight gain that you have is all fat. So you lost 5 pounds of muscle, you've replaced that with 5 pounds of fat. So even though the number on the scale is exactly the same, whatever it was that you started, let's say 200 pounds. You started at 200 pounds, you lost down to 170 or 180, you gained it back. You're right back at 200 pounds, but the same clothes that you were wearing before don't fit you. You also don't look as fit. We all know people that are overweight, but they look fit. They are still, they are in decent shape. They look decent. But when you yo-yo up and down, you gain the weight, lose the weight, gain the weight, lose the weight. Every time you do that, you alter your body by increasing the amount of fat that you have, the percentage of body fat that you have, and the amount of muscle mass that you have decreases. So now instead of looking fit, but overweight, now you look doughy and your clothes don't fit you and your health has deteriorated because now the higher your percentage of body fat, the more susceptible you are to heart attacks, strokes, the onset of diabetes, etc. So that is one of the problems with calorie restrictive diets. And that is the model that all of the strip mall diets, anybody that puts you on a weight loss program that restricts your calories, guess what? If you do what they tell you to do, exactly the way they tell you to do it, you will lose weight every time. The problem is, as soon as you revert back or you stop doing that strict dietary regimen, you gain the weight back, usually exceeding what you lost. So so we learned probably 15 years ago that calorie restriction was not the best way to lose weight. So what was the alternative? The alternative was changing your metabolism and allowing your body, turning your thermostat up so that under more activity or even the same activity, your body now is metabolizing fat instead of storing fat, and you lose weight. By altering your metabolism now, that weight loss usually lasts longer and can be permanent if you continue to use some of the supplements, and your weight loss is more fat than muscle. So you look healthy, you look fit, you start to get muscle definition, and you're not working out. And let me say this, and I say this every time I have this discussion: you do not lose weight in the gym. Going to the gym is for fitness purposes. You can get fit, you can improve your aerobic health, all of those things. You lose weight in the kitchen or wherever you're getting your food substances from. So what's important is what's coming in, the number of calories, what's going out, so to speak, and then going out is what you're burning with calories. So a very effective and efficient workout will only last, let's say, of an hour. That's the average time people work out, or they plan to work out. They give themselves an hour to work out. Most people don't do that, don't even approach it. But let's say you do the perfect workout for an hour, it's high intensity. Guess what? You burned 800 calories. And you say, wow, that's good. Well, no, it's not really, because it takes 3,500 calories burned to lose 1 pound. So that is why most calorie restricted weight loss programs take away about 500 calories a day times 7 days is 3,500, and they guarantee you 1 pound weight loss per week. They usually round it up to 5 pounds, let's say 5 pounds a month, although no month has 5 weeks in it. But they'll say, 1 pound a week, 5 pounds a month. And that's the standard weight loss model that has been in the United States for as long as I have been a practicing physician. Well, we have learned that altering your metabolism, much more effective way to do it, lasts longer, you look better, you are healthier, you improve and decrease your chances of high blood pressure, diabetes, heart attack, or stroke, and your overall health improves and you look good. And guess what? When you look good, you feel good. When you feel good, endorphins kick out. You laugh more, you're enjoying life more, you're just more active, you're spending quality time with your friends, you're enjoying your family and your spouse, and your life is totally and completely different. So it is, those simple things in life that add up to a higher quality of life. Okay, so that's my spiel for today. Now I want to answer your healthcare questions. So, should my mom get the vaccine if she has COVID? Yes, she should. And one of the things that we have learned is that when you have had COVID, your body will develop natural immunity. That is without question a scientific fact, and that is good immunity, and it protects you from the current variants that are out there. But if you get even one dose of either of the vaccines, that includes the Pfizer, the Moderna, or the Johnson & Johnson, you increase your immune response by over 300%. And if you get both doses of the two-dose vaccines, you are literally what Dr. Collier likes to say, a super soldier. Now you are amazing. You can't catch it. You can't give it to anybody. You are great. And you're in your optimal immune response position for this, not just this, but other viral infections as well. So yes, I recommend that she gets it. And the original thing that was being stated is that you would wait 3 months after you've had the infection. I think there was no scientific basis for that. I think they were telling people that because there was a shortage of vaccines, and they wanted people who didn't have immunity, a natural immunity from having the infection, to get a vaccine versus someone who had not been infected and was at higher risk. So now, again, I tell my patients almost as soon as they recover from being infected that they can get the vaccine, and I'm recommending that you do. So unless there's any other contraindications, mom should get it. Why after having the vaccine and you still get COVID? I don't understand. Because the vaccines at their best were 95% effective. That means 5% of people, Sharon, 5% of people were still susceptible, and we are still not approached that 5% number. As of a few weeks ago, the number was about 2.8% of people that were, quote, outliers, people that had gotten the vaccine and were getting the infection. So that number still has not approached 5%. But when you hear about particularly famous people, celebrities get it, you're hearing a lot about it. But when you think about the millions of people that are exposed on a daily basis that have gotten the vaccine, the vast majority of them are still are protected from the virus. And if you do catch it, you have a milder disease state. You're rarely hospitalized, and just no deaths being associated with that. So this is a pandemic now of the unvaccinated. So everybody needs to get your vaccine. Don't let the fact that you hear about people that are having breakthrough infections deter you from getting it. Get it ASAP. That's the best thing that you can do to optimize your health, because this is going to get much worse as we approach the fall and the winter months. Okay, Janice Harvey, are you taking any new patients? In Atlanta, all day, every day. Dr. Collier's taking new patients. You can call me. Call my office, Atlanta West Primary Care. The phone number is 770-948-5400. I'm going to say it again, so don't worry about rushing to get a pen right now, but 770-948-5400. Lock it into your cell phone or just Google me. It will come up. Atlanta West Primary Care. We take care of men, women, adolescents, and we do all disease states: high blood pressure, diabetes, high cholesterol, virtually anything that would affect you, and it's culturally sensitive healthcare. So we'll be glad to take you on this new patient. Just tell me, Janice, just call when you say you saw me on Facebook Live. We'll get you in the office as quickly as possible. So thank you very much for your interest. Okay, Donovan D. When you run through the list of items we're supposed to take every day in the dosage amount. Donovan, great question. Okay, these are supplements. Supplements is the key word. I know the term vitamins is being tossed around, but vitamin D is a vitamin, and the dose should be 5,000 international units per day. Next is omega-3 fish oil. Omega-3 fish oil usually comes in a capsule of 1,000 milligrams. My omega-3 lipo omega has 1,480 milligrams per capsule. You take one in the morning, one in the evening. That is ideal. And then there is vitamin C. Vitamin C, 1,000 milligrams per day in the morning usually. And then zinc, anywhere from 30 to 50 milligrams per day. 30 is usually more than enough. If you're a larger person or you think you have more immune challenges, 50 milligrams. But as you start to get to the higher doses of vitamin D, it might irritate your stomach. So what I recommend, again, is you take the zinc mid-meal. So you start eating, you take the zinc, and then you finish eating your meal, big glass of water, and this should not bother you. But I also have been utilizing a zinc lozenge. You just put it under your tongue. It melts and dissolves under your tongue, and it's very effective. Doesn't bother my stomach at all, and I think it's a great alternative. So I've loaded up on the zinc from that perspective as well. But in our lipoimmune, we have zinc, we have elderberry extract, and we have the elderberry extract, zinc, and liposomal vitamin C, all in one capsule. You can get it all twice daily in doing so. Thank you, Donovan. We appreciate that question, sir. Okay, KK, I took my Pfizer vaccine. Is it normal for the area that you received the shot to be itchy? Yes, it is. That is a normal vaccine response. It also can feel like a solid lump for a while. They call in that condition COVID arm. Is it okay to get the second vaccine when the time comes? Yes, I would get it in the other arm, and I would also prepare myself. What Dr. Collier recommends for people that are getting the vaccine is that you take an anti-inflammatory such as Motrin, Advil, or Aleve starting the day before you get the vaccine. And the Motrin and the Advil will be 3 times per day dosing. The Aleve is twice daily. Start the day before the vaccine. Take it the day you get the vaccine and the day after you get the vaccine. I also add a non-sedating antihistamine to that treatment regimen. That would be Claritin or loratadine. That would be Zyrtec, which is cetirizine, Zizal, which is levocetirizine, the left-handed version of the cetirizine, and Allegra. All of those are readily available over the counter, and you can start taking them the day before you get the shot. Take it the day you get the shot and the day after you get the shot, and that would minimize your side effects, but it does not negatively impact your immune response. There were questions before about taking Motrin or Advil or Aleve before you took the shot, that it might inhibit your body's immune response. That myth was proven to be wrong. And so people were saying take Tylenol. Tylenol is strictly for pain. Tylenol is not, hear me again, Tylenol is not an anti-inflammatory. Tylenol / acetaminophen is not an anti-inflammatory. It will not give you that benefit. So unless there's a reason for you not to take an anti-inflammatory, like you're on a blood thinner or you have problems with stomach ulcers, etc., then I would default to Tylenol. It's still better than taking nothing, because it will help with pain and soreness in the arm. But an anti-inflammatory is what you need, because the problem is one of inflammation. The site that you receive the vaccine becomes inflamed. That is the normal immune response. It happens more dramatically in some people, but oftentimes when it happens more dramatically, it means your body's immune response is greater. So it's a good sign and a reaffirmation that the vaccine is working for you. However, you still don't want to have a sore arm. So take the anti-inflammatory, take the non-sedating antihistamine, Claritin, Zizal, Zyrtec, or Allegra. Would you give a list of items and supplements for children that are underage for the vaccine? For children that are under age 12 and are not eligible for the vaccine at this time, we still want to boost their immune system. So again, I definitely would recommend zinc. The zinc lozenges are perfect for children because they taste good, and children will take them because it's like candy. But make sure they only take the appropriate dose. They don't take extra, because we don't want to make their little tummies hurt. But the one that's sublingual, the sublingual lozenge, the one that you take on your tongue, is perfect. And then vitamin D, depending upon the child's size, the vitamin D dose can be as little as 1,000 international units or up to 5,000. Most children these days that are in their teen years, 13 to 15, again, those are eligible for the Pfizer under the emergency use authorization. But kids younger than 12 are still, over 100 pounds and probably can take adult doses. But I would, get a recommendation from your child's pediatrician, or you go to a place like the Vitamin Shop or a place that specializes in supplements, and they can give you a recommended dose. Or, just when you buy the bottle, it should tell you, for children ages so-and-so, this is what the dose should be, and just follow those directions explicitly. But again, in concert with and consultation with your healthcare provider for a child, a pediatrician, find out what doses that they're recommending. But they definitely should be taking the vitamin D, the zinc. They can take probiotics. But a good way to get probiotics into children is to give them yogurt. Any flavor they like. Yogurt is great. You can give it to them every day as a dessert after dinner or after a meal, or give it to them for breakfast. And you will have no difficulty getting that down in the children, because most kids like it. And just give them a flavor that they like. Particularly the ones that have fruit on the bottom. Children seems to like that, and so not a problem with them. Okay. Tam Scorpio's finest, West. Thank you, Tam Scorpio's. Please provide suggestions for kids who catch COVID since they are all back in school. One, you got to isolate the kid, and you got to be very careful once you bring the sick kid back into the home, because the mother, who's usually the primary caregiver, always gets sick. Now, the father, may get sick depending upon how much time he spends with the child and the mother, but the mother always gets sick, and oftentimes other children in the house will get sick as well, because the coronavirus is a respiratory virus. It is in the air. Particularly if a child coughs or sneezes, there's a cloud of virus that anybody in that room will be exposed to. So you want to keep the child wearing a mask if possible in the house, and make sure that the people that are around them or with them are also wearing masks. Of course, contact surface cleaning. Soap and water is ideal. You don't have to use an elaborate cleaning product, but of course, things like Lysol are very good. Microban, other things that you are familiar with. A 10% Clorox solution works wonderfully, but literally, plain soap and water, which is not toxic, you can use to clean virtually anything, is very effective in killing the coronavirus. So you have to make sure that during mealtime, that child is isolated. You feed them in their room only. You try to get one bathroom for them to use and nobody else in the house uses, and just to minimize the opportunity for the virus to spread through the home. It usually does, but unless you're very careful and you follow those guidelines 100% of the time, you might be able to survive and get through it without everybody else getting sick. But anybody who is exposed, who hasn't had the vaccine, should get their vaccine immediately. My daughter has lupus. Is there anything she can take for hair loss? Lupus is an autoimmune disease, for those who may not be aware of it. It causes a butterfly rash, usually a rash above the eyes and below the eyes, and it goes right through the nose, which is why they call it a butterfly rash, because it looks like a butterfly when you look at a person's face. And they also usually have alopecia, or loss of hair. So I recommend vitamin D is very good for that, because it is a natural anti-inflammatory, and it cuts down on the inflammation that is at the hair follicles, which is what makes you lose the hair. Your hair is one of the fastest growing tissues in your body, and it has a large and substantial blood supply. But when those blood cells, the capillaries, are attacked on the cellular level, and they're unable to provide nutrients to the hair starts to fall out, and you get or you get thinning and bald spots. So one of the things you want to do is that I would supplement with a vitamin regimen, including I like prenatal vitamins, because prenatal vitamins give you the optimal doses of all vitamins, and they usually have something in them so that the iron won't constipate you. And now they have a full line of prenatal vitamins that you can get over the counter. You can get them virtually any drugstore, Amazon, just Google prenatal vitamins, etc. And maintaining just good health. And any treatment regimen that she's on usually includes steroids to keep the lupus under control. Then that will also help with the hair loss. So good luck with that, Yolanda. Thank you so much. That was a wonderful question. How long do the antibodies last after contracting COVID? Jazzy Tay asked that question. The natural immunity that you get right now in real time has been measured to last up to 9 months, probably longer. There are studies from around the world that say that the natural immunity will last up to 36 months, and that time is extending as more time passes. So again, you may have lifetime immunity after getting and having the disease. So if there are no variants that develop that are resistant to the natural immunity that you get from having the type A, which was the original coronavirus. Some of the variants were now down to the Delta variant, the D, and then the Lambda variant, which is coming. None of those are still getting around the natural immunity that you have from having had it. But to optimize your immunity, take the vaccine as well. Any dose or any of the vaccines that are available, all three of them have been shown to work with your natural immunity to increase your protection by a factor of at least 300%. So I'm recommending that you do that. But the answer to your question, Jazzy Tay, was that how long does it last? And again, right now, confirmed actually 9 to 12 months, probably longer. Dr. Kaya thinks it's probably a minimum of 2 or 3 years, and it may be lifetime. So right now, we haven't seen anything that varies. Kathy Davis says, I'm taking vitamin D and I was prescribed 1 per week. Can I take vitamin D3 as well? Kathy, guess what? You're on vitamin D3. It comes in a 1 time per week dose of 50,000 international units. Remember what Dr. Collier recommended, that you take 5,000 per day? Okay, 5,000 per day times 7 is 35,000. But if you're taking the once a week dose, that's 50,000 international units. So that will optimally give you the doses that you like. And so you don't have to take any additional vitamin D. You're getting just what you need. I have my own patients that have such a significant and severe vitamin D deficiency. Remember, the normal range is 30 to 90. When I get someone that's less than 10, I don't waste time giving them a daily dose. I put them on the 50,000 international units once a week dose, and I'll keep them on that for at least 3 months, usually 6 months. Get them over 60, between 60 and 90 on their regimen, and then offer them an opportunity. I do one of two things. I put them on a daily dose of 5,000, or I decrease to 50,000 for one per week to one every other week. So 2 pills a month to maintain a good level of your vitamin D. So that's where we are with that. You're on a great regimen already, Kathy. Now add the vitamin C, 1,000 milligrams per day, and the zinc, 30 to 50 milligrams per day, and your immune system is optimally boosted. Again, other things like elderberry extract have been shown to have phenomenal responses as far as your immune system are concerned for bacterial infections, viral infections, and fungal infections. So these are all things that will help with all of those types of infections, not just viral infections, but traditionally we've had problems. Does chromium help with decreasing diabetic glucose levels? Yes, Donna Bird Etienne. Great question, because chromium, again, is one of those miracle things that was discovered that will help but not just a diabetic state. Chromium also helps you lose weight. It helps optimize fat metabolism. So chromium is a good supplement, but that is in addition to, not instead of, whatever you're taking for your diabetes, but it will help. There are other things that will help as well. But again, there's such great medications for diabetes now. The SGLT2 inhibitor class drugs, you've seen them advertised, Farxiga, Jardiance, Steglatro. There's others. But my point being, those medications lower and control your blood sugar and make you lose weight. And the reason why is that they cause glucosuria, or they cause sugar or glucose to pass through your kidneys and come out of your urine. Normally the glucose goes through your kidneys, is filtered, but it's reabsorbed right back into your bloodstream, so your levels remain high. What the SGLT2 class drugs do is make you urinate the sugar out. When you urinate the sugar, you also urinate the calories associated with that sugar, and that's what makes you lose weight. It is an amazing phenomenon, and people that have had friends and family members that were diabetic that would take those medications and lose weight. Of course, they weren't diabetic, but they wanted that medication because it made you lose dramatic amounts of weight. Again, guess what? Unfortunately, it doesn't work in people who aren't diabetic because they don't have excess sugar. So it's not going to cause them to have the glucosuria. So not that, but there are other classes of drugs, the GLP-1s, of which there's now an oral version called Rybelsus, and now there are injectable versions. There's a new medication on the market called Wegovy. It is a GLP-1 that makes you lose weight. It's specifically made for people who are not diabetic, who want to lose weight. And it will make you lose up to 20% of your body weight over time. And it is consistent weight loss. You don't gain the weight loss. You don't gain the weight back when you stop using the medication, or you can continue to use the medication and continue to lose weight. But once you're down to about 20% of your body weight, the process slows down tremendously, so you don't get too much weight loss. But the drug is so popular now, they cannot manufacture it quickly enough. But it's available now, and the company that makes it has a special going on that you can get a month supply for $25, and you can do that for up to 6 months. After that, you'll either have to pay the full price, or your insurance company will have to cover it. But in 6 months, you probably could obtain weight loss of up to 20% of your body weight. The objective is to try to keep it off. That is Wegovy, Wegovy. Check it out, Google it, and ask your doctor about prescribing it for you, because it is a prescription medication, and it is changing the game of weight loss as we know it. I have added it to my treatment regimen in my weight loss facilities, and I think it's very popular. We're seeing in real time the benefits of it. How do the Lipodrops work? Great question, Barbara Hewitt. The Lipodrops, again, they contain 2 key amino acids for optimal fat burning. That's L-carnitine and choline, and it also contains vitamin B12 for cellular energy and for the permission. It turns on the weight loss process in your body so that your body does not fight you when it's time to lose the weight. So it replaces those things. And the original Lipodrops formulation did sound quite well. People would take the Lipodrops, they place it under their tongue before meals, and they would lose weight. And so, of course, when people lose weight, they say, well, if one dropper full will do it, then 2 dropperfuls will do even better. So this was not recommended by Dr. Carrier in any form or fashion, but people did it. And guess what? People lost more weight. So we decided then we needed to evaluate this and study it and see if a higher dose would result in greater weight loss. And what we found out was that if we increased the dose, and we did that and created the formulation of Lipodrops Max, the Lipodrops Max formula has 10 times the choline, L-carnitine, and B12 in it than the original formulation, and results in greater weight loss. So that's the formulation now that most people are asking for. It's the one that most people are getting. But go to the website, lipodrops.com, as you see behind me, lipodrops.com, and it will evaluate you. There's a questionnaire that asks you about how much weight you want to lose, how quickly you want to lose it, your body type, any comorbid conditions that you may have, etc. And if you address that, it will make recommendations based on those factors, and it will tell you the products that you need to take, because there's a full line of things. And so people ask me, they say, well, how much can I lose and how quickly can I lose it? And the answer is, it depends on a variety of factors. But the thing is that to obtain greater weight loss over a shorter period of time is going to require various parts of products in the product line for weight loss. So look at the probiotics, look at the Lipo Cleanse. One second. Look at the probiotics, look at the Lipo Cleanse, we have a product called Keto Max now, which gives your body a pseudo phase of ketosis. Everybody's aware now of the keto diet. Is very, very popular, and it's very, very effective. The keto diet is nothing but a renamed version of the Atkins diet and a harder version of the South Beach diet. South Beach is Atkins diet light. It allows you to eat a few more things, but the Atkins diet is very strictly keto. You go into ketosis very quickly, and when in this state of ketosis, your body burns fat for fuel instead of using sugar. So when that happens, when you're in the state of ketosis, a couple of things change. One, you get keto breath. And that means your breath, no matter how much you brush your teeth, no matter how much you gargle, your breath smells pretty foul. And so when that happens, and there's nothing wrong with your mouth. The problem is coming from inside your body, and you're acidotic and you're blowing off acid, which does not have a pleasant smell. And when you're in beta ketosis, it affects every body fluid that you have. So when you sweat, you're going to smell ketotic. Under your arms, it's going to smell ketotic. And guess what? In your groin area, you're going to smell really bad. So never a good time to do that. You have to, so we call that keto crotch. That phenomenon is keto crotch. I've had women that are on the keto diet come to me. They think they have infections or whatever. That's not the case. Me and you are not absent from this as well. They come in and think something is wrong. It just doesn't smell right down there. They've lost weight, but they're not happy with that odor and aroma. So that is absolutely one of the side effects, but it does make you lose weight. And it's strong enough. How strong does it have to be? It's strong enough for you to notice it and for people around you to notice it. So you're not socially acceptable during that period of time that you're on that you're in ketosis. So the Keto Max product uses things that gives you ketones and helps you metabolize fat, utilizing the same or similar mechanism. So one of the things you want to check out, the Keto Max, the Lipo Biotic, which is a probiotic that helps with digestion and also boosts your immune system, but it optimizes your gut formulations and helps with what's called the leaky gut syndrome. Okay, Lanice Sean Wilson, I'm diabetic. Can I take B12 pills with Jardiance and metformin? Yes, you can. B12 pills are perfectly compatible. Jardiance is one of the medications I was talking about before, the SGLT2 inhibitors that makes you spill the blood sugar, the glucose in your urine. So it makes you lose weight, and it does an amazing job. The combination of Jardiance and metformin addresses almost every defect that you have as a diabetic. So it literally is like not being diabetic. You still a diabetic. You are not cured, but you are well controlled. And it's like, again, some of the things, particularly the microvascular problems that you have with diabetes that result in heart attacks or strokes or amputation of limbs, just don't happen because you don't have those issues. So Jardiance is one of the preferred products. I think it's one of the better molecules, if not the best of the class. And of course, the metformin, the number one most prescribed diabetes medication in the world. The ideal dose is 2,000 up to 2,000 milligrams per day. In the United States, a lot of people would take 1,000 milligram tablets with dinner. That can cause GI upset, and a lot of people abdominal pain, cramping, diarrhea. What I recommend is a treatment regimen that was developed in Germany, where you take as little as 500 milligrams of metformin, but you take it with each meal. So it's been found that taking 500 milligrams of metformin 3 times per day with your breakfast, your lunch, and your dinner results in much more effective blood sugar control, and it's much easier on your GI tract. So people rarely have side effects from that. So I utilize the German model in my medical practice, and I get much more effective control, sometimes with just metformin alone. But my first add-on product is an SGLT2 inhibitor, such as the Jardians. All right, great question. Darlene Rogers Heath. What can I do for my 20-year-old daughter who's been diagnosed as anemic? Her hemoglobin was 8.4. She's currently on ferrous sulfate, which is iron, 2 tablets per day. The problem with iron, it can be constipating. So we need to make sure that she's taking something like a stool softener, 1, 2, drinking enough water so that she does not get constipated, because it just makes you feel miserable. And we got to build her blood up. The question is, we need to find out the etiology of her anemia. Anemia is just affirmation of how low her hemoglobin level is. You want the hemoglobin to be between 12 and 15. Hers is 8.4, so she is anemic. Now the question is, why? Is she having excessive menstrual bleeding, which is the most common cause in a woman of childbearing age? She's having very heavy periods. Then you can do something for that, like putting on birth control pills that can even stop her menstrual cycle or limit it to 2 or 3 days so that she's not having heavy bleeding. Or is she losing blood from any other place? Does she have a blood disorder like sickle cell or thalassemia or something else that would give her anemia level that low? But most women of childbearing age, once they start, they're perfectly normal as far as their hemoglobin is concerned until they start having periods. They start having periods. The only time they're not anemic is when they're on prenatal vitamins during pregnancy, or once they go through menopause, then all of a sudden they're no longer anemic. So the menstrual cycle is usually the culprit here, but not the only option. It needs to be evaluated completely. So follow up with her primary care physician or with a GYN to make sure that this is not a problem, because when she gets that low, it can cause pain in the calf and causes a thing like pica, where people crave eating things like ice. They'll crunch ice all the time. It usually does damage to their teeth. Or they eat things like a clay or starch, and they can't help it. They're just motivated to do so. We're not sure why those particular items, they don't provide sustenance or improve the anemia, but it's just one of those things that people crave, particularly the ice. I've seen people do that. So the hemoglobin, we want to build it up to 12, ideally 15. So great question, Darlene. Thank you so much for your question. Okay, Tara Harden, my A1C is 6.1. Am I considered pre-diabetic or diabetic? You're considered pre-diabetic, but Dr. Collier literally hates that term. Diabetes, you're considered a diagnosis diabetic if your hemoglobin A1C is greater than 6.5. So it's 6.6 or higher. Before, there were only 2 categories, diabetic or non-diabetic. Then they created this phenomenon. Anything greater than 5.7 to 6.4 was pre-diabetic. Now, pre-diabetes is like being a little bit pregnant. Either you are or you're not. Being pre-diabetic means you may be more susceptible to it, particularly if you have a strong family history. If your parents, your brothers and sisters, your grandparents are all diabetic, then you have the same building blocks. Your house is made from the same materials, so that your body is more susceptible to diabetes. It does not mean that you're going to become diabetic. When you're pre-diabetic, it's good to then monitor what you're eating, try to keep your weight down, etc. So it's a challenge to, when you're diagnosed as pre-diabetic, to obtain a better lifestyle, do more exercise, again, monitor your calories to keep your weight down so that you don't convert to diabetes. There's actually now a genetic test that you can take, and I give it to all my patients that are, quote, pre-diabetic, and it determines their susceptibility to actually becoming diabetic. If that test is negative, and it basically is telling me they'll never become diabetic, we don't have to be as strict on what we're going to do with them as far as lifestyle is concerned. But if that test is positive and it shows me that they're destined to become a diabetic, then I'm going to make lifestyle changes immediately to either prolong that transition or stop it from happening completely by, again, dramatic weight loss and other things that you can do to do that. Sometimes I will even start a patient to take metformin, just one pill a day, and that usually will keep that under control and lower the A1C so that they don't, it again prolongs the time period that if you are destined to become diabetic, it may add 10 years to that time. So instead of becoming diabetic at 40 or 50, now you want to become diabetic at 60 or 70 or something like that. So again, just in partnership with your primary care provider, you can control pre-diabetic and never allow it to become full-blown diabetes. Okay, Kamika Burton. Not sure if you have covered this, but can I do to aid in getting my taste and smell back after COVID? Well, one of the things that's been shown is an amazing phenomenon. People that have had COVID, recuperated from COVID, and then get the vaccine have recovered their sense of taste and smell. That has been a remarkable side effect of the vaccinations, and we're not sure why that happens. We just see that it is happening. It's not associated with one vaccine over the other. They have seen it with all three of them that are available in the United States. So if you've not been vaccinated, get the vaccine. Other than that, I would recommend, again, a vitamin regimen that would include probiotics, omega-3 fish oil, and vitamin D. Again, natural inflammation. The problem with COVID is inflammation. Natural anti-inflammatories can help your body heal, restore itself to a normal condition. But there are people that are, quote, long COVIDs. We're seeing this. Some people are recovering their sense of taste and smell in as little as 4 weeks. Other people it's taking 6 months. Other people, they're 9 months out from their infection and they still haven't recovered it. So it just will depends on a variety of things. But again, you can't go wrong taking those supplements that help, one, quote, boost your immune system, and two, decrease inflammation in your body naturally. I mean, if you have not had the vaccine, get the vaccine. You can't lose it. One, it will boost your immunity to a repeat infection. And more importantly, if one of the side effects is it gives you back your sense of taste and smell, you have benefited greatly from it. No downside. If it doesn't happen, it doesn't happen. But if it does, quick cure. Okay. Monica Felton. Will we have to get a booster every year if people are not getting vaccinated? Well, you might have to get a booster every year, regardless of whether people are getting vaccinated. I don't think that is going to be the case. I'm not on the booster bandwagon at this point. A week ago, the FDA, the World Health Organization, and other health bodies of the CDC were saying a booster wasn't necessary. Then toward the latter portion, this all happened in a 7-day period. 3 to 4 days later, they were saying that people that were immune compromised, had a solid organ transplant, or were being actively treated for an autoimmune disease or cancer could get a booster. Then they recommended that they do get a booster. 3 to 4 days later, all of a sudden, everybody needs a booster. Part of that was based on a study that showed the efficacy of the coronavirus vaccines was decreasing over time. But the efficacy of both the Pfizer and the Moderna were 95%. The Pfizer now has decreased to 50% or less. The Moderna is still at 85%. So definitely, if you were fortunate enough to get the Moderna vaccine, the studies are showing that it has decreased from 95 to 85, but I would take 85% protection in Las Vegas any day of the week. So right now, Dr. Carr is not advocating getting a booster. Something may change, and next week I may be on the booster bandwagon. But right now, my medical opinion and what I'm telling patients is I don't think you're going to need a booster yet. If you've had the Johnson & Johnson, that question is being asked in real time, and they have not answered it because they say the Johnson & Johnson has not been out long enough for them to have gotten the information and complete the studies. So I definitely think, because they were already looking at giving a second dose of the Johnson & Johnson anyway, because its efficacy was 65% at best when they first presented it. So I think that they will go to a 2-dose regimen with the Johnson & Johnson. Again, if you have had the Pfizer and now you are 8 months out from your completion of your first 2, then you will be eligible starting September the 20th. You'll be able to get a booster if you like. Again, I just don't think it's going to be necessary, but if things continue the way that they're going, 3 to 4 weeks from now, we may be in a worse pandemic situation than we have ever been throughout this entire coronavirus. So if we're back on lockdown and everybody's wearing masks and goggles and gloves again, and requiring PPE in the office, then yes, I'll say we would need to get a booster. Great question, Monica. Thank you. Cheryl Godbot. What can you take for cramps in your feet, fingers, and upper thigh areas? Well, there are lots of things, but oftentimes when that is happening, your body has a potassium deficit. That would be the first thing that I would check. So you can go to your doctor and get blood work to check your potassium, or you can just supplement your body's potassium. One of the best sources of potassium that you can do is bananas, and also all of your citrus fruits. So orange juice, grapefruit juice, etc., are very good with potassium. There's a treatment that was recommended before that is no longer available, but you can get it in tonic water. And so you've heard, of course, of vodka and tonic, the same Canada Dry tonic water or other any brand that you like that you find at the grocery store. You can get a big bottle for no more than $2, and just drink that every night, about 4 ounces of that before. It has quinine in it. Quinine is the active ingredient that gives you that. And so you want to do that. The quinine will do it. Quinine fights the cramps and will help you feel much better. You can take it, you can add some lemon or lime to it if you like. It doesn't taste bad. Just about 4 ounces every evening with your dinner. You can drink tonic water around the clock if you like. You can use it instead of any other thing that you would drink and see if that gives you some release. But I would definitely recommend that you get your potassium level checked to make sure that that's not the problem, because a low potassium can cause a lot of other problems, particularly cardiac arrhythmias. Okay, Cheryl, thank you. Great question. Roxanne, the real Roxanne Robin. Do I have a regimen of supplements that I can recommend for someone diagnosed with pancreatic cancer? Had the Whipple, but 2 months later, results indicated the cancer had metastasized to the liver and the lungs. Definitely, once again, anybody who's been diagnosed with a cancer of any type, vitamin D is one of the first things that they recommend for individuals. But there are now new classes of drugs called biologics, and there's custom-made therapies for cancers where they can take a sample of the cancer, design a product specifically to attack that cancer and only that cancer. So no damage being done to the rest of the body, no damage being done to any other tissues, no hair loss, no muscle loss or anything like that. And they have made some dramatic treatments for not just pancreatic cancer, but breast cancer and all of them. Google biologic therapies for cancers and get more information and work with your oncologist that's taking care of you, I'm sure, and find out what your other options are in doing so. Great, Roxanne. Thank you so much, and good luck with your treatment regimen. Tam, Scorpio spines, are the piping drops safe for teens? If you mean the Lipodrops, okay. that autocorrect is horrible, isn't it? Yes, perfectly safe for teens, particularly adolescents that are overweight. Again, we recommend it for ages 18 and above, but I know parents that have given it to adolescents off label, so to speak. It's just vitamins and supplements. There's nothing in it. There's no stimulants, so it won't cause any negative reactions in children. But again, the label recommendation is 18 years and above. But we have now, adolescents, kids 15 years of age that are, 200-300 pounds. So it's important to give them what they need as well. And so they're obviously having problems and difficulty metabolizing their fat. But again, in concert and consultation with their primary care provider, their internist, family medicine physician, or pediatrician can give you more insight. Marlene Kennedy, does acid reflux ever go away? Usually not. It is a chronic condition, but there are phenomenal medications that work to take care of it, particularly things you see advertised all the time: Prevacid, Nexium, Omeprazole, Pepcid. One of the number one medications that they use for it was called ranitidine or Zantac. That is now off the market, but they are basically reviving it by using famotidine, which is the same medication as in Pepcid, instead of what they had in it before, ranitidine. So those are all good. If the problem is a physical phenomenon such as a hiatal hernia, and that is where a part of your stomach comes above your diaphragm, and the valve that's there at your esophagus that stops fluid from coming back up is no longer able to close efficiently. So when you're digesting food, your stomach contracts in 3 different directions, like a bag being squeezed. And when that happens, the liquids that's created in there flushes back up your esophagus. Now your stomach has a mucus lining in it that protects it from being digested, because otherwise it would digest itself just like it digests a steak or any other meat that you eat. But once you're outside of the stomach and up into the esophagus, there is no mucus lining protecting it. So the esophagus will literally be digested just like any other meat or product that you would eat. So that's the most common area to get an ulcer from that reflux. Or you can get what's called Barrett's esophagitis. It can eat into your esophagus, cause strictures as your esophagus tries to heal itself. So now food is not easily passed down. Or it can perforate your esophagus, which becomes a medical emergency, particularly if it perforates it around an artery or a vein. So that is a major problem. And, if that happens, you're going to have a major GI bleed. Second most common, peptic ulcer, the first part of the intestines after the stomach goes. So there we are. Okay. So I see we're coming to the end of our broadcast. We thank you very much. Beverly, you get the last question. Can I refresh you again on the importance of not taking ibuprofen? There's no importance of not taking ibuprofen. Ibuprofen is a great product, highly recommended unless there's a reason not to take it, as in your own blood thinners for having had a pulmonary embolism or clots in your legs, deep vein thrombosis, etc. But or if you have stomach issues or a history of stomach ulcers. Other than that, ibuprofen is a great anti-inflammatory. It works wonderfully for whatever's ailing you. It lowers fever. It lasts longer than Tylenol to lower your fever. So instead of 4 hours, it will last 8 to 12 hours. It will take care of myalgias, which are the body aches as well, and it just will make you feel better. So ibuprofen, which is what's in Advil and Motrin. Aleve is naproxen sodium. It is also a great NSAID or anti-inflammatory. NSAID means non-steroidal anti-inflammatory drugs. And those classes of drugs include all of those things: naproxen, ibuprofen, Advil, etc., versus the Tylenol, which is just acetaminophen, which is a pain medication. It's strictly for pain relief. And it does work very well for doing that. It will bring down fevers, etc. But oftentimes if a person has a fever that is not responding to Tylenol only, I will add and or alternate. You take an ibuprofen and take Tylenol on various hours to keep the temperature down around the clock. Just makes whoever's sick feel much better. Fever sometimes is good. You hear people saying you need to sweat out the disease state. Yes, you do, but it works much better. So thank you, Beverly. This brings to an end this episode of the Your Health is Important Facebook Live broadcast. I'm Dr. MJ Collier, host, producer, on-air personality, and your medical ready reference. Thank you so much for tuning in. We'll see you next time. Remember, we do Facebook Live on the 2nd and 4th Wednesdays of each month. Tune in at 6:30 and we'll answer your questions for as long as you're asking them. Thank you so much. Listen to me live, the Ricky Smiley Morning Show.